So thank you for coming on, Mala, onto Courageous Dialogues. I'm actually really interested in speech, and because essentially when people ask me, is English your first language? The answer is really confusing because my parents actually arrived to Australia about 52 years ago. So when I was born in Darwin, in a community where my parents pretty much came to Australia with the rest of Sicily. And so by the time I got to school, we'd spoken a bit of, Italian and English, and I'm fairly certain a lot of made up words. So if you have a look at all of my report cards going back at primary school especially, you can see the comment, she mumbles a lot. Yeah, and interesting enough, a few years back when I got into teaching and I was asked to do a presentation at Parliament for a history thing that I was involved in. Come the day, I was all prepared. I'd never presented an oral presentation like that. And I started stuttering, and I don't have a stutter. Yeah. And after that, every presentation going forward, I was stuttering. So I ended up going to see a speech pathologist. Yeah. And they said, and it was interesting to me because they said that my nerves were actually hitting my speech, which was affecting my performance. So then she gave me some strategies on how to deal with it. And look at me now. I'm podcasting with you.
You're doing exactly. You can put yourself more out there.
Yeah. So I'm actually really interested in speech, and thank you for coming on to Courageous Dialogues. So
it's a pleasure to be here. So
thank you. Can you tell us the time that you were courageous?
Thank you, Tanya. That's a good question. So I guess starting speech pathology for schools 6 years ago, for me, was a courageous step. So I willingly stepped into the unknown, believing that I could sort of shift the way or present more value to the way speech pathologists and schools worked together. So when you invited me to be part of this podcast, it got me thinking about what is courage. And so I went back to G.K. Chesterton, who's an author and a theologian and philosopher. And he actually defines courage as the willingness to move forward despite the uncertainties. So I think if you truly believe in something, then courage just comes. So the reason I was able to be courageous was because I really believe in, the United Nations Convention on the Rights of the Child, so that, education is a basic human right for every child. And with that belief, it makes it easier to sort of take that step forward with courage. So 6 years ago, despite my uncertainties of how schools were going to cope with my, views on how I thought the collaboration between speech pathology and schools could actually work, I put myself out there and I stepped into the uncertainty, and I met with 3 schools, and all 3 schools decided that they would like to be part of that journey with me. So, then I thought, I never thought that I'd be employing people, but with 3 schools on board, I had to sort of again step into that uncertainty, and willingly did that, and, started speech pathology for schools with myself and 2 part-timers. And then now 6 years later, we've got almost 30 employees. We're across schools right across Melbourne, and, moving into interstate as well. So I think, again, it comes from that belief in what it is that you're doing and why. And then, despite that uncertainty, just stepping forward. So I think that's probably my example of the courageous decision.
So thank you. You've most definitely impacted on someone's life. Like I know my speech pathologist impacted on mine when she explained all about the nervous system and Kate gave me strategies. Can you tell me an example of a life that you've changed?
Yes, so there was a little boy who I used to see. He was about 8 years old in one of the primary schools that I worked at, and surprisingly, going from your conversation, Tanya, he actually had a stutter. So it's quite a significant stutter, and he, was impacted with his ability to participate in the classroom, as well as his ability to participate with friends and family. So we, using evidence-based practice, worked together on his stutter, and we achieved a really positive outcome. And recently, through social media, he got in contact with me to let me know that he's now studying speech pathology and is in his final year doing speech pathology, because he was inspired by the impact and the change that that had on his life. So I've got to say that for me, that was a very heartwarming moment and probably a career highlight to see that impact, you know, so many years later on a student that you worked with. So yeah, that would have to be a very special moment.
It's bizarre when they come back and do that to you. Not only do you feel old, but you feel a little bit of an accomplishment there, I know. So tell me, you're very provocative in your space, and you've got 30 employees, you work closely with schools. What have you done lately that has been provocative in the education space?
So I guess to me, being provocative is to be able to influence or change the way someone's thinking. So the most provocative thing that I've worked towards is, as I said, to shift that speech pathology service delivery to being one that schools, it's fully embedded in that school context, in that school community, and to do that with scale across a number of schools. So moving away from that very traditional clinical speech pathology model where you go in and see the speech pathologist in a room and, you know, they send you back to class. So incorporating all of that in that concept of it takes a village to raise a child. So I recently read an interesting book called The Hidden Life of Trees by Peter Wallenbaum. And it was quite fascinating because it talked about how the forests thrive, and it's through that connection, through, you know, the root system, as well as, you know, the sharing of resources. So it was amazing. And it was something that I then took and spoke about at one of our recent conferences with my team, and talked about recognising that for speech pathology, for schools to thrive, that we too needed to focus on being connected. So it's the secret that I learned from the trees, and being connected at many levels is what I believe will make us thrive. So, you know, we've connected with universities in Australia and internationally. We foster greater connections amongst our team, collaborating on projects and supporting each other. Here's a question I've got for you, Tanya, that you might think may have an obvious
before
answer.
You say that, I'm actually loving what you just said, because it actually aligns well with living systems and the connections we have, the web of connections that we have. So I've just absolutely loved what you've just said. So hit me with your question.
So my question is, do you think trees in a forest compete for sunlight?
No.
No, so well, I always thought that they did, so that you had the trees at the top who were competing for the sunlight with the lower trees, but they don't. And so they actually work in this symbiotic relationship. So, and through the hidden life of trees, I know that the established trees form that canopy so that the new saplings have the space to grow sturdy rather than just tall. So, you know, getting the nutrients that they need through the mycelium in the soil, and then being able to sort of develop at the pace that they need. So it's really quite a Goldilocks, you know, setting where they've got, everything's got to be just right, and for them to do. And so perhaps it shouldn't be provocative, but for me, that how we form that village to support the child in that school context with, you know, parents and school leadership and team teachers, as well as the speech pathologist, was that shift to being provocative. I think also, please do.
I was just going to clarify, because a lot of schools do have that model where a speech pathologist walks into a room and, you know, works with a child and then on their way. But your model's a little bit different, isn't it? In terms of your LSOs are trained and they're working within the classroom with the teachers. Is that correct?
It is. So basically, our speech pathologists engage with all stakeholders in the school community. So that's school leadership teams to make sure that we're heading in the direction that the school wants, so aligned with school action plans and things like that. We engage with parents to make sure that, you know, follow up at home and things like that are happening. And we are part of in the classroom. So often the speech pathologist will team teach with the teacher to make sure that, you know, we're in that response to intervention framework, supporting children at all tiers in that school context. So yes, we do have a training program for education support staff as well, so that we do a module so that, you know, research has shown that the impact of an LSO working with a student is minimal, but if you actually harness, you know, the LSO and train them to be so that what they're doing is really supportive and targeted, they can make a really big difference. So I guess what Speech Pathology for Schools is about is really looking for the unmet need in the school and then working as a school community in collaboration and partnership to sort of make a difference. So it's very different from that clinical speech pathology model that people talk about. And, during the last 2 years of the COVID disruption, it had a major impact on particularly the vulnerable learners that we would normally deal with. And so, we just stepped in there, and I think we supported over 1,000 students directly. We impacted over 6,000 goals working with those students. And then through the training and support of teachers, we impacted on, 9,000 plus more students. So it's that whole school approach working together, I think, is, what really is making that difference.
Yeah. What a good model. And in terms of the learners, is it very different in terms, I'm just curious, the work that you would do with early learners, primary school students compared to, I imagine, secondary, that would be very different. But in terms of identifying who needs a support, is it harder to do that with secondary students?
It's not, because often it's quite evident, because the gap between them and their peers is so pronounced by secondary school that it's not that hard to identify. Okay. The range of what a speech pathologist can do in a school context is so broad, and I think often people don't have that understanding that speech pathology is more than just stuttering or articulation or even language, that we do actually do a lot in that literacy space. And so particularly in the secondary school, children who have been identified as having dyslexia or significant gaps in their literacy, really helping them to be able to access the curriculum is so important. If they haven't learnt to read, they can't use their reading to learn. So it's almost clearer in the secondary school. Our aim is to get in early with the early years, so that we can hopefully bridge that gap before it tends to increase.
Yeah, so as you were saying that, I was just like, I got that wrong. It's harder at early childhood primary to identify, I imagine, than secondary.
Yes, it is. And that's one of the reasons why we encourage the schools, and we use this whole school data. So, there's no point coming into a school and, having a different data set from what the school's got if you want to actually talk to the school about shifting their student outcomes. So we use the school data as well as other data that we might, incorporate into that classroom. But we try to get broad classroom data so that, you can start to look at patterns of students and where they're actually progressing. So that you start early, you make a difference as soon as you can.
Yeah, okay. So can I just touch on something? You just touched on something just as you were speaking. I'm just going to read the following statement, and I would love your thoughts on it. Schools need to focus more on speech than reading and writing within the curriculum to lift the standards of education in Australia.
I think that's an interesting statement. So again, it goes a little bit into that broad scope of speech pathology. I think all those three things, the oral language, reading and writing, are crucial for a student to be able to engage in learning. So they're what, Scarborough calls them the strands of a reading rope. So, the strands together, twisted together, is what makes that rope more robust. So I think all three of them are foundation skills, but they all are impacted one by the other. So you actually need all three of them to really make a difference. But without any one of those, for any student to then be able to not only engage in their own learning, but to engage in society and the community around them, it's very limiting. So I would actually say all three of them are interchangeably important.
And do you do a lot of work when you're working with individuals in terms of reading, writing and speech? What does that look like?
Again, so looking at the testing to see where the greatest need is with each student, and it'll vary. So some students, even though their oral language is good, their literacy might be poor, whereas some students might have difficulty across the board. So, oral language underpins a lot of what you're actually doing. So there's a lot of research, by a number of people like Professor Pam Snow and, Kerry Heppenstall and people like that, who've really looked at, the importance of all of these things in the learning.
Yeah. Okay. So what have you learnt over the years when it comes to speech and individuals and working with others as well?
I guess for me, it goes back to that concept of it takes a village, excuse me. It takes a village to raise a child, and really that the approach that we do working with our schools is that it's not us coming in as a specialist to say this is how to do it. It's not teachers sort of, shutting their door and sort of staying in their classroom and doing their own thing, but it's really working together as a community towards that belief of, everything we can, looking at the data and the evidence. So I think that's a key part of what speech pathology for schools is about. So I think schools have got better at using data, to look at where their students are. But I think where teachers are still on the journey of using that data to inform teaching practice. So the speech pathologist working with the teacher is looking at that together, but not just sort of making the recommendations, but actually working with the teacher in the classroom to say, how can we implement these recommendations, within that classroom context.
That's really important. We've got loads of data. It's the actual implementation in terms of how you read it and what you use it for, and in terms of the inferences and how to use it in the classroom. So tell me, how has your model changed over the last 6 years? And in particular, I guess the impact that COVID's had, you've mentioned that before. So what does that look like now?
I think the thing, as we scaled up and we've got more and more schools, I really wanted to make sure that we continue to provide a service that's individual to each school context. So that's why that importance of working with the school leadership is crucial, so that we're looking at what the school plan is and working with the school leaders to shift that practice. So as things have changed and developed, we have stuck by some of the tried and true, so things like the data-driven, the evidence-based, the engaging all stakeholders. But we've made sure that we are actually working with each school to look at their student population, their school needs and their priorities. So different schools will have different priorities in terms of what they want to focus. Having got that broader knowledge, we do have a lot of data that we can use. So we know, what makes a difference, in certain contexts. So we're in, across a variety of schools, we've got that collective knowledge. So again, that connection between, our speech pathologists as a team, but using that as connections within that school context to sort of say, these are things that other schools are doing and these are the things that make a difference.
Fascinating. I just sort of asked you so many more questions. I'm just putting on my parent hat, and I've got a 4-year-old who doesn't talk, who points at things, and just won't talk at all, is read to, seems to play well with others, but the parents are concerned. What advice would you give them if they continually go to doctors or specialists and say, there's something wrong with my child? What can they do if they hit brick walls?
I think getting help early, if you've got any concerns, is a really important step, because we know that early intervention is going to bring about the greatest good. So, there are little things that you can do to encourage children to speak, and you need to sort of look at why they're not speaking. Is it that they're getting everything given to them without needing to speak? So, or is it that they've got older siblings who do the talking for them, and so therefore they don't? So, looking at that, again, that individual of the child, the context and why that's actually happening. And then you also want to make sure that they're actually understanding. So if they are being read to and they're engaging in the book, even if it's not verbally, they're still developing their language, even if it's not expressive language. So you want to look at, a whole variety of things. But my advice to those parents would be, if you've got any concerns at all, you're your child's greatest advocate. So, start the journey with a speech pathologist, and even if it's something as simple as giving you some strategies to hold back a little bit and allowing your child the space to talk, get those as early as you can.
Thank you. I will tell you now. I did ask that because my son did that when he was young, and I kept taking him everyone to get tested and all of that sort of gear. And it turned out Kayla was talking for him. We needed to mute her a little bit.
Yeah, and like if they just point and they get what they want, then there's no functional purpose for them to talk.
We call that spoilt now. Oh no, thank you so much for coming on to Courageous Dialogues.
Oh, it's an absolute pleasure, Tanya. Thank you for inviting me to be part of it.